The month of February is set aside to recognize women's heart health. Cardiovascular disease is the top killer in this country among both men and women. But women face some unique challenges. Here's the latest in this week's Positively Healthy. It's a fact. More women in this country die as a result of heart disease than cancer. But the dreaded C word does not refer to cardiovascular disease, although it's the greater danger.
I feel like as women, we're so busy all the time, taking care of our kids and our husbands. We're not really in tune to our bodies.
Dr. deLeon-Mansson is a board-certified cardiologist. She believes there's a gender gap when it comes to awareness.
And so I think it's important to inform women and educate them on subtle symptoms that are specific to women.
Women are more likely than men to discount heart symptoms, in part because they may feel things differently.
Such as jaw pain, nausea, lightheaded, abdominal pain. Those are typically symptoms you don't hear when somebody's describing symptoms of a heart attack.
Another fact, upwards of 70% of women have underlying risk factors. Far fewer seek advice from their doctor.
The most important thing is to know your personal risk factors, and that's why seeing a cardiologist is very important, because we can ask you the questions, figure out what your family history is, if you had a history of smoking, diabetes, being overweight, physical inactivity, all of these risk factors.
An additional point of difference between men and women is that women are less likely to go to the emergency room with heart issues.
Women can, of course, have chest pain, chest pressure, but there are the subtle symptoms that they should be aware of that need to be evaluated.
Prevention should always be the first course of action, and it begins with assessing personal risk, then following up with a plan to minimize any modifiable factors like smoking and weight. When women don't, it can have heartbreaking consequences.